It's the diagnosis no one wants to hear: cancer. According to the National Cancer Institute, with 50,000 deaths annually, colon cancer is the second leading cause of cancer death in men and women in the U.S. But these deaths are preventable through colon cancer screening.
Well, there are several options to screen for colon cancer. There's the fecal occult blood test, flexible sigmoidoscopy, 2 different radiologic tests, the barium enema and virtual colonoscopy. But in the end, we have colonoscopy, which not only allows us to see the whole colon and discover growths that are abnormal, but also to remove them at the same time that they're discovered.
Physicians believe that colon cancers begin as smaller benign growths called polyps many years before they transform into malignant tumors. Since most patients develop cancer of the colon later in life, regular screening is recommended to begin at age 50 in average-risk patients.
The first thing I would say is that polyps are much more common than people realize. Over 25% of men at their first colonoscopy are found to have precancerous polyps, and over 15% of women. So we often encounter polyps during these procedures, and we routinely remove them at the time of the procedure using a variety of techniques.
More than 140,000 new cases of colon cancer are expected to be diagnosed in the U.S. this year. Colon cancer is the disease that affects both men and women. Today, the average person has about a 1 in 20 chance of developing colon cancer during his or her life.
Polyps may or may not cause symptoms, and the vast majority of polyps do not cause symptoms, which is why it's really important that anybody over 50 undergo colon cancer screening. Having said that, certain symptoms such as rectal bleeding, abdominal pain, a significant change in your bowel habits certainly merit seeing your gastroenterologist as soon as possible for evaluation.
Coming to the end of your colon.
Colonoscopy, the most effective screening method for colon cancer, provides a thorough examination of the colon and reduces the death rate from colon cancer by 53% in those who have had precancerous growths removed.
People have many misconceptions about both the preparation and the procedure itself, which results in about half the people who should have had colonoscopy not having them yet. The preparation involves a modification of diet and drinking lots of fluids over the course of 12 hours so that the colon is very well prepped for our examination and we can find even small polyps. We conduct the examinations in special suites that have been certified and have highly trained nurses, and we use short-acting sedating agents so that patients are very comfortable in addition to their warm blankets. And they wake up saying, "When are we getting started?" and the procedure's over.
I was diagnosed with a polyp that was in the stages of turning into colon cancer. So it wasn't officially colon cancer yet, but within maybe months. If it wasn't for the colonoscopy, I probably wouldn't be here today. It would have eventually turned into colon cancer, and I would have died from it.
Puget Sound Gastroenterology is a physician-directed organization providing comprehensive gastrointestinal medical services to patients and referring physicians in the Puget Sound area. The practice is a multifaceted organization with 22 board-certified gastroenterologists and 5 nurse practitioners in 6 locations.
So we are a group of board-certified gastroenterologists who provide a range of services. In addition to high-quality colon cancer screening, we really treat all aspects of gastrointestinal health.
Puget Sound Gastroenterology is dedicated to caring for patients with digestive disorders. Its staff, from physicians to nurses to support staff, is committed to providing high-quality, cost-effective medical care with compassion and consideration for the comfort and concern of its patients.
I thought to myself, well, you know, I really ought to go in and get a screening. I was 54 at the time, and I thought, you know, I shouldn't wait any longer. I just should go in. And I was asymptomatic as far as I knew. And surprise, you've got colon cancer. And so that decision to get a screening is what started the process of saving my life.
Colon cancer is the second leading cause of cancer death in our country. Colon cancer screening is very important. We can prevent this tragedy through screening. We can make colon cancer preventable, treatable, and beatable.
It's such a treatable disease if you catch it early. And that's why the screening is just so important for me. And I've told my family, I stress how important it is because, frankly, I wouldn't be here very possibly if I hadn't gone in.
As research continues to combat the formation of all types of cancers, colon cancer is preventable, treatable, and beatable. For more information about Puget Sound Gastroenterology and its advanced diagnostic technology for colon cancer, visit PugetSoundGastro.com.